Hi, I'm Victoria Weiner with Ascent Education. It's me, the DRG guru. And today I'm bringing you an episode of Did You Know? In today's topic, we're going to talk about the new obesity guideline update as of April 1st. But really, the saga started back in October. Back in October, we got a code update for the code expansion of the obesity codes. So let me show you those. What you see here is the E68 6.8 codes expanded to capture class 1, class 2, and class 3 of obesity. And now if you're me, you're like thinking, do we really need any more obesity codes? In short, yeah, we did. The problem is that historically, we've always been focused on the BMI to be the indicator for comorbidities. Now, experts are showing it is not the tell-all to indicate what is a comorbidity risk patient. So we're still going to capture all of that, but now we've got new detail to acknowledge. Class 1, low risk, that would be your BMIs of 30 to 34.9. Moderate risk, a BMI average of about 35 to 39.9. And class 3, obesity, that is equal to or greater than 40% for the BMI. In kiddos, that's for adults. In kiddos, it's a little different. We've got based on the percentile. You can see it up here on the screen, class 1, 95th, greater than the 95th percentile, and so on. Well, here's the important thing we have to remember. We need to acknowledge these codes based on the instruction we're given. Back in October, the only information we were told was code according to what's in the record. That really wasn't enough. What that was saying was, don't you, coder, take the BMI and equate it to the class 1, 2, or 3. Really, that is the physician's discretion based on the risk factor and their interpretation of the patient's risk for comorbidity. Why? There's so many things that influence what is the risk. So, for example, athletes. Athletes have a high BMI because they have more muscle mass and muscle weighs more. That doesn't mean they're at higher risk for a comorbidity, not at all. And there's another interesting factor. Caucasians and Asians, when compared, Asians have a higher risk for diabetes and cardiovascular disease at a lower BMI rate. So those variables influence the physician's determination of what class the patient should be in. So we cannot interpret that and take the BMI and put them in a class. Well, there's a little bit more to the problem. This turned into a auditing nightmare for the past 6 months. Yeah, by the way, thanks for giving us a little bit of a delay in instruction with the code. Yeah, what we had was the auditors, for example, I'll give you an example for myself. I would say the documentation indicates the class you should capture this, and they'd say, no, the doctor documented morbid obesity. I had no leg to stand on, no instruction to say otherwise. Well, because it's really not the impactful reimbursement code, the BMI is, the Z code, I really didn't worry about it. Well, now we have instructions. Yay! Obesity is more defined at Official Coding Guidelines IC4B1 now. And there, I'm going to break it down for you. It explains that there are multiple obesity codes in the code set. ICD-10 can capture codes in obstetrics, and then we can capture the E codes to indicate the obesity, morbid obesity, and even more detail like the effect it is having on the patient. For example, patients with morbid obesity can develop the Pickwickian syndrome or the hypoventilation alveolar syndrome. Then we also have another code that indicates the cause, and that would be something like the disruption of the MC4R pathway. Well, those are all bits of different information that tell the story. And if we need to capture different codes to identify those details, we should do that. Use all the codes necessary to tell the story. Now, the instruction indicates one little caveat, and that is don't code unspecified morbid obesity with class 3 obesity. Why? Class 3 is more specific and includes the information of morbid obesity. So that is your Did You Know for today. And if you like this episode of Did You Know, feel free to follow Ascent Education for more coding tips.